Have people filtering in, but we do have a lot of information to get through today, and I want to be mindful of everybody's time. We're going to stand up at the podium today. This session is being recorded. It'll be available via a YouTube link that we will post on the benefits page on WashNet as soon as it becomes available. Today we have presenters here from NFP, Health Partners, and Select Account. We're going to walk through our benefit offerings this year and give you some information on how to compare plans. We will ask that we hold questions until the end, just because this is being videotaped, and that way anybody that wants to flip through the presentation later can get all the information up front, and then if they want to hold on for the questions at the end, they'll be able to do that as well. I also want to call to everybody's attention, right away this morning, we had sent out an open enrollment link with several pieces of information in it. One of the pieces I want to call your attention to right away is a link to what's called Designing Your Benefits book. This has the detailed plan offerings for everything we have this year, along with the rate sheets for the 2018 proposed contributions. I want to just bring to your attention that we do say proposed contributions because although we have tentative agreements with several of our bargaining units, if your bargaining unit does not have a tentative agreement or has not voted yet, there will be an alternative rate sheet in the booklet that you can refer to help you plan your benefit choices. All right, with that being said, we're going to go ahead and jump right in and get started. My name is Katie Berggren. I'm the benefits manager here at Washington County. I've been here for 2 years now. Have to say it's a great place to work. I'm really glad that I'm here. I came from higher education, so still find myself getting used to the new environment, but really glad I'm here. So this year's open enrollment is going to go from November 1st through November 15th. We have the same plan offerings that we had last year, and with two little different things. First of all, everybody, just by attending this session, earns a Win Wise Healthcare Consumer Credit, so be sure to sign in because that's how I'm going to be able to tell Beth Brisky to give you that credit. Secondly, we are converting to a new HRIS system, which means that this year, unlike last year, we want everybody to complete open enrollment. This is going to ensure that data is accurate going into the new HRIS system. It's going to help us with auditing purposes and make sure that the uploads go out correctly to our carriers. By completing open enrollment through self-service, you will earn a second Wise Healthcare Consumer credit, WIN credit. All right, so make sure that you plan a time to go into self-service between November 1st and November 15th to get that second credit. If you have any questions about how to complete open enrollment through self-service, there is an open enrollment user's guide that's posted to WashNet on the benefits page. All right, so let's jump in. 2018, what are our plan changes? Well, not much. We're still with Health Partners. Health Partners has made an update that includes travel and lodging being covered for transplant recipients having to travel over 100 miles. There is some other limits that apply. On the $35 copay plan, there's now a $2 copay for all injections that take place in a physician's office other than an immunization. On the high deductible health plan, the IRS has mandated that high deductible minimum be $2,700 for employee-only coverage and $5,400 for family coverage. The HSA annual contribution limits have increased to $3,450 for single enrollment and $6,900 for family coverage. And on our dependent life, we've made one small change, and that's to allow coverage for your dependents up until they're age 26. All right. As with last year, we have two different plans. We have our open access plan, which means that you have open access to the whole Health Partners network, and we have our Distinctions Tiered Network plan. The Distinctions Tiered Network has benefits in Tier 1 or Tier 2, determined by the quality and cost of the care within each of those tiers. All right. So the big question on everybody's mind, every open enrollment, is what will I pay for my health care? You'll notice in the open enrollment announcement that we sent out a teaser that said $5 health care premiums. $5 a month for health insurance is phenomenal. And what you do to get that is you simply enroll for single coverage on the high deductible health plan, if that's what you want, if that's the best plan for you. The next few things that we're going to go through is to help you decide if that's the best thing for you. So, what will I pay this year? On the high deductible health plan, like I said, it's a $5 monthly premium. That's your cost based on the tentative agreement signed for the 2018 proposed contributions. On the $35 copay plan, it's $47.40, and the open access $900 deductible plan, $30.77. We've annualized the rates below, so an annual premium on the high deductible plan is $60. An annual deductible on the $35 copay plan is $568.80. And that middle plan, the open access $900 deductible plan, is $369.24. This presentation is available to you to refer to later because I know it's a lot of numbers I'm going through, so we sent you a link to it. All right, so let's do some cost analysis. One of the things that I get asked a lot is, what is my best case versus worst case scenario on the plans that we offer? And so what we did this year is we took some time to kind of lay out some really basic examples of what your best case scenario would be. In other words, if all I did was go and get my preventative care, which is covered at 100% on all our plans, and then paid my monthly premium, what would that look like for me? So let's take a look at what that looks like for you. On the $35 copay plan, what it looks like to you is that you've spent $569. On the $900 deductible plan, you've spent $369. On the open access $2,700 plan, you're actually plus $1,240. Your money ahead. And that's because Washington County gives you a $1,300 contribution towards your HSA account that you can use to pay for any medical expenses. But if you don't have any medical expenses in the plan year, all you do is get your preventative health care, then all you've paid that year is the $60 premium. All right, so let's take a look at what does the worst case scenario look like. We know that on all three of our plans, we have deductibles that are associated with each of those plans, and we have co-insurance that's associated with each of those plans. So on the $35 copay plan, what it looks like to you is if you get all your care in Tier 1, your costs are going to be $2,869. If you get your care in Tier 2, you're going to be $4,769. Those are dollars out of your pocket that you've paid for your health care. That includes your premium and your out-of-pocket costs. On the $900 open access plan, your worst case scenario looks like $3,869. And on the high deductible plan, your worst case scenario looks like $2,460. That's what it's going to look like to you. Now this is all for single coverage. So you ask, what does it look like if I have a family? All right. It looks a little bit different. Obviously the numbers are a lot higher because you've got family coverage, so you've got multiple people on your plan. But let's walk through it again. So what does your best case scenario look like on the $35 copay plan with family coverage? You've spent $7,754. That's just the cost of your premium. And preventative care is covered at 100%. On the open access $900 plan, you've spent $5,105. And on the open access $2,700 plan, you've spent $1,858. Now, what does your worst case scenario look like? That's the one that people are always most interested in. If I go in and I have that catastrophic year, what am I going to have to pay? On the $35 copay plan, you're going to have to pay $12,354 if you get all your care in Tier 1 for family coverage. On Tier 2, if you get your care in Tier 2, you're going to pay $16,154. That's what you're going to pay for family coverage if you get your care in Tier 2, worst case scenario. On the open access $900 plan, you're going to pay $12,105. And on the open access high deductible plan, you're going to pay $9,258. You'll notice that the HSA plans, that high deductible plans, is lower because we're counting that HSA contribution that the county makes. And on the family side, the county makes a contribution to your HSA at $1,700, and that's put in that account right away. All right, so that's a whole lot of numbers, but what does it really mean? So let's look at some real life scenarios. What could it look like, right? So we're going to walk through a scenario for single coverage for a person that goes and gets their annual care. They take one preventative maintenance prescription, so your thyroid medication or whatever you take. You get the flu and you go to see the doctor. You hurt your knee biking. You get an MRI. you require outpatient surgery, and you've got some physical therapy. So very common, realistic, plausible situation that we're going to look at here. So let's look at what it looks like in terms of the numbers, right? All right. So on my $35 copay plan, that monthly preventative prescription is going to cost me $240, my $20 copay per month, or I'm going to pay $180 if I'm on the $900 plan, or I'm going to pay $312 if I'm on the open access plan. I want to call attention to those blue stars that you see on the screen. Those blue stars indicate dollars that are counted towards your deductible. Okay? And the next row down, we go in for our preventative care. You'll notice that's a 0 all the way across. That's covered at 100%. You go to the doctor for that flu visit. It's $35 on the copay plan, $150 on both open access plans. It's the full cost of the doctor's visit, right? You get a prescription from that office visit. You're going to pay $20 on the $35 copay plan, $15 on the open access 900, and $38 on the open access high deductible plan. All right, so now you're going to go in for that surgery. On the $35 copay plan, you haven't paid anything toward your deductible yet, so you have that full $900 that you're going to have to pay right off the bat. So that $3,000 cost of the surgery, the very first $900 you're going to pay in full. The remainder of that $3,000, that $2,100 that's left, you're going to pay 10% of that. That's that co-insurance piece, because the insurance is going to kick in at that point. So the total cost of that surgery for you is going to be $1,110. On the upside, you've now met your deductible in full, so now you've got co-insurance for the remainder of your plan. Let's look at that same scenario on the $900 plan, and you'll see that you've got $750 that is left to pay in that $900 deductible, so you're going to have that right off the bat. And then you're going to pay the co-insurance at 25%. So of that $2,250, you're going to pay 25% of that. So the total cost of that surgery to you is $1,312.50. Okay. On the high deductible plan, you've got $2,200 left of your deductible to meet. So you're going to pay that first $2,200 of that $3,000 surgery, but you're only going to pay 10% of the remaining balance, so that cost of that surgery is $2,280. Now you may be thinking right now, wait a minute. It looks like the $35 copay plan is a way better deal for me because I've only paid $1,110 for that surgery versus $2,280. Well, wouldn't I rather pay the $1,000? Well, stay with me here because I'm going to explain to you a little bit. Now that we've met that deductible in full on all of our plans, it's going to look differently when we get to the totals. So now we go in for our physical therapy visits. On the $35 copay plan, I'm going to continue to pay that $35 office visit for each one of those therapy sessions. On the open access $900 plan, I'm going to pay $45 each because my co-insurance covers it differently. Whereas on the open access high deductible plan, I'm only going to pay $18 each because I'm only paying 10% of the cost of that visit. I go in for my MRI. The good news is on my $35 copay plan that's covered at 100%, it's called preventative diagnostic imaging, diagnostic imaging, and it's covered at 100%. On both of the open access plans, I'm going to pay the co-insurance part. So when I look at the total cost of services for this scenario for the year, I'm at $1,615 on the $35 copay plan. I'm at $2,227.50 on the $900 open access plan. And on the open access high deductible plan, I'm at $3,008. So you're probably still thinking, well, that open access plan is way too expensive. But let's take a look now. The next thing we want to do when we're analyzing these things is we have to add in the cost of our premiums. That's that guaranteed dollar that we have to pay no matter what. So when we add in the cost of the premiums with the total cost of care that we've received in that year, we're sitting at $2,183.80 on the $35 copay plan. On the open access $900 plan, we're sitting at $2,596.74. And then on the high deductible plan, you'll notice that we're sitting at $1,768, dramatically lower than the other plans. And that's because that $1,300 that $1,300 that Washington County gives our single participants on the high deductible plan are the first dollars that we've paid. So we haven't paid those dollars out of our pocket. So what's left for you to pay out of your pocket is the remaining $1,768. All right, On Tier 2, everything is the same, but if I were to get my care in the $35 copay plan in Tier 2 instead of Tier 1, I'm looking at an annual total of $3,233.80 for the exact same scenario. Okay. All right, we're going to do the same scenario on family coverage. And we're going to add in a couple of other things, because now we've got a family on here. So we want to see what it's going to look like if I've got multiple people using the plan. So in this scenario, we have mom, dad, and child. So we've got 3 annual preventative visits. We have 1 parent that takes a monthly medication. Both parents catch the flu, hopefully not at the same time. In the family, we've got 6 office visits, 1 for each parent, and the child goes 4 times. For the prescription, each parent gets a prescription and the child gets 2. We have that same knee injury, and then in addition to that, baby needs to get tubes in their ears. All right, so we look across the top. The very same row looks the same as it did in the single coverage. No change there. In the preventative exam row, no change there. Those covered are still covered at 100%. Now let's look at those office visits. On the $35 copay plan, they're always going to be $35, whether it's mom, dad, or baby. On the open access plan, those office visits are going to be $150. You're going to get charged the full cost of those office visits on those open access plans until the deductibles are met. We're going to the office early in the year, so we haven't met those deductibles yet, so we're going to pay the full amount. Again, the blue stars indicate costs that are paid towards our deductible. All right, so we're going to go down to the prescription line. We've got those 4 prescriptions on the $35 copay plan. It's just the $20 copay for each of those prescriptions. On the $900 copay plan, it's on the $900 open access plan, we've got $15 a copay, and then on the high deductible plan, we're paying $38 a prescription. So we'll see mom has 1, dad has 1, and then this said the child has 2. That's what those variations in costs are. All right, so now we're coming into that surgery. So when we look at the surgery, we have 3 people on the plan going into the $35 copay plan. None of the 3 people that have received care yet has paid anything toward that deductible. So we're going to say dad has the surgery. So dad still has the full $900 to pay on that surgery. So it's going to be the same exact scenario as the other example in the single plan. And dad's going to pay $1,110 towards that surgery. Same thing on the $900 plan. $1,312. No doubt, only the office visit had been charged to that $900 deductible, so still $750, just like in the other example. On the high deductible open access plan, it's a little bit different this time because all of that activity with mom, dad, and baby is also counting toward that deductible. And so there's a little bit more that's been taken off. So you're looking at $2,512 being left to pay in that deductible. So in this scenario, the surgery for dad's going to be $2,560.80. So now this is where it's going to get a little bit more complicated. Now baby goes in to have surgery. Remember, on family plans, we have both our individual deductible and our family deductibles to meet. So individually, it's $900 a person on the $35 copay plan, up to $1,800 for the family. So once we get to $1,800, then the coinsurance is going to kick in. So when we look above, dad's surgery has helped knock down that $1,800 to the family limit on that plan. And so coming into the surgery, there's only $690 left to pay for baby to get to that family deductible limit. And then the coinsurance is going to kick in. So the tube surgery is only going to cost $831 in this scenario. On the $900 plan, it's going to cost $725. When we look at it on the high deductible plan, because we do have a higher family deductible to get to, we have $5,400 we've got to get to, it's going to be $1,527.68. But now, on all of the plans, the deductibles are met, right? So everything now is to the coinsurance level. So the physical therapy visits are the same as they were in the previous scenario. The MRI is the same as in the previous scenario. So when we look down at the total cost for services in Tier 1, on the $35 copay plan, this family has paid $2,681. On the $900 plan, they've paid $3,747.50. And on the high deductible plan, they've paid $5,560.48. Now, when we want to go back and we're going to add in the cost of our annual premiums. So the total cost to this family to be on the $35 copay plan this year was $10,435.40. On the $900 open access plan, it's $8,852.18. And on the high deductible plan, it was $7,418.84. We wanted to lay this out for you with real life examples so that you could see when we look at how a same situation happening on all three of our plans ends up costing you a very different amount of money depending on the plan that you're in. We take into consideration the cost of the premium and the amount of the HSA contribution that Washington County makes for you. It makes a dramatic difference in the total overall cost that you're paying for your health care. And that's really what we want people to be aware of this year, is we want you to be wise healthcare consumers and to know what you're getting, know how it's covered, and know what the overall impact is going to be to your pockets. So, that was a whole lot of, yeah? That's a good question, because that's right where I'm going next. Okay, so I've been talking a lot about the health care, or the HSA plan. The HSA plan can be paired with our high deductible plan. We're going to talk a whole lot more in depth when Select Account comes up here to talk about that. But right off the bat, we want you to be aware that if you've always been in the $35 copay plan and you're comfortable spending that amount of money on your health care, you've been doing it for years, I'm just going to keep doing it. What we want you to do this year is entertain the idea of spending that same amount of money, but spending it in a new way. So the example that I have on the screen right now is just an example of taking that same amount of money and instead of enrolling in the $35 copay plan, enrolling in the high deductible plan, and then contributing the difference in the premium, money you were going to pay anyway, into your health care savings account, so into your HSA. And what does that look like? So, if I'm in the single plan, instead of paying $568.80 for my coverage, I'll choose to pay $60 instead, and I'll put $508.80 into my HSA. That's going to be added to the $1,300 that Washington County provides. And then at the end of the year, if I've had a good health year, I've just gone in for my preventative care, nothing has come up, I've got $1,808.80 into my HSA, money that I don't use and will roll over from year to year. More dramatically, if we look down at the family level, if I did that same thing, I would have contributed $4,196.04 into my HSA. That would have been added to the $1,700 that Washington County provides in my HSA, and I would have ended up with $5,896.04 into my HSA. That's a large sum of money, right? So if I think about that large sum of money, and I look back to that scenario as a family that I just showed you, if I had done that, I would have had $5,896 already set aside to pay for those expenses. And the total cost of services that I needed to pay for in our previous example was $5,560. So you can see that just by doing that, I would have been $335 ahead. I would have had money left over after paying for all those expenses and my premiums that would have rolled over to the next year. Before I go further, I'm going to hand it over to Health Partners. We're going to talk about the FSA, those flex dollars, a flexible spending account, and then you had mentioned flex credits. Flex credits are something that everybody gets that works at the county, and those are just dollars that offset your cost of any benefit that you roll in, whether it's health care or dental or vision, whatever the case may be. Those flex credits are there for you to use to offset benefit costs. If you don't enroll in any benefits, it's just income to you. All right, I'm going to roll it over to Health Partners, and then we'll have questions at the end.
Good morning. My name is Brian Rudy from Health Partners, and today I'm going to walk through what Katie just did for every person in this room, because we have a tool available to you as members where you can actually see how this would affect all three plan designs, how they would affect your amount that you pay on an annual basis. We're also going to look at some different ways to get care and how to find the best price on care. And first of all, I want to walk through our tool that's called Plan for Me. If you do have your book, the blue book, or green medical plan book, on page 7, you'll find these instructions on it for Plan for Me. What Plan for Me does is help you find the best place or the best plan to get care. So it compares plan options, it'll see what medical prescriptions are covered, what doctors are covered, do all the comparison for you. So you see the website that's linked here. It says healthpartners.com, Plan for Me. When you go to that website, it's going to ask you for 3 pieces of information. First piece is your group number. For Washington County, it's 3271. And you can see that on the piece of paper that's in front of you. The site number is Site 0, and the plan effective date is 1/1/2018. Once you enter that information, it will ask you a number of questions about you and your family. How many kids do you have? Do you cover a spouse? What kind of conditions do they have? Do they see the doctor a lot? Do they see the doctor a little? We'll also ask you what providers you see, what prescriptions you take. And at the very end of that, it'll compare all 3 plan options for you on a pure cost basis. Because we know that all the medical plans cover the same services, cover the same doctors, cover the same prescriptions. So it's really just a financial question for you. So if you want to do that same comparison that Katie was just walking through for your specific situation, you can do it on Plan for Me. Now, we know that there is a lot of places to get services, and each place you go really has a different price. As you can see on this road map, the ER for a simple respiratory infection is $750. If anyone's ever been to an ER for something like that, you know you're at the very back of the line too. So it's not going to be a 15-minute wait or 20-minute wait. It might be an hour or 2 to see a doctor, and it'll cost you $750. Urgency rooms, urgency centers, you see that's the next one down the road, $340 for that service. Urgent care, it's maybe when you go to a clinic and they have an urgent care after hours, that's $175, $140 or so for an office visit, and virtual at $45. Now, if you've ever thought about these prices, you're probably wondering, where can I do that price comparison? How do I know how much is this going to cost me at an ER versus an office visit? Well, the first place I would point you is to healthpartners.com. If you haven't already, I would sign up for a username and password. You can just use the member ID number that's on your member ID card. By doing that, you'll be able to get into your own personal website. And by clicking on Find Care, you'll be able to do a provider search based on the services that you want to be seen for and with cost comparisons. So for instance, on the screen, I did an MRI of the lower extremity without dye. I just typed that in and said, I'm looking for around Woodbury, Minnesota. What are the cost comparisons that I can see? And based on my plan design, I would pay $84 at the Smart Choice MRI, and at Twin Cities Orthopedics, PEA, I would pay $129. Frankly, that's not very dramatic. If I did the same comparison and looked at, say, Regions Hospital, you would see that same service cost $600 or more. Yes, there's a question?
Is there a function on there that allows us to determine which one is a tier 1?
Yeah, it will do the cost comparison based solely on your plan design. So if it is a tier 1 clinic versus a tier 2, it will show you the difference in costs. That's the cost comparison tool. I also mentioned Virtual. Has anyone heard of Virtual? We've been talking about Virtual for years now. Hopefully people have at least heard it. If you haven't tried it, it is free under the $35 copay and $900 deductible plan. And it's only $45 on the HSA plan. This is by far the fastest and cheapest clinic visit you ever have, because it's for those top 60 or so common conditions. So think of this clinic as being good for pink eye or bladder infections or sinus infections. If you've ever had a sinus infection, you don't need to go to a doctor to say, I think I have a sinus infection. You know exactly what that feels like. So by going to virtual.com, you can actually say, I think I have a sinus infection. I'll ask you a number of questions about that. What does it feel like? What does it look like? And then at the very end, it'll throw all that information down to our nurse practitioners in Bloomington. It'll be reviewed, and they'll send you back a treatment plan, diagnosis, and a prescription if you need one. So in the span of about 30 minutes, you'll have the whole service complete, and you can start feeling better without sitting in an ER at 2 in the morning trying to see a doctor. So if you haven't given a